what our pee is revealing about our overall health. Please welcome Dr. Sharma.
Hey! Welcome to the show. Great to be back. So good to have you here. Okay, we all know we pee, all right, but why do we pee?
Well, you know...
Yvonne?
No, that's a great question. In fact, you know, my three-year-old daughter actually asked me that yesterday morning as well. So, fair question.
It is.
What we're doing is we're filtering all the bad stuff out of our bodies. So maybe we'll start with a diagram of our kidney system.
So let's bring that up here on the board so you can kind of walk us through, because that's a picture of a toilet, as you can see now, and that's not a toilet.
That's not a toilet. So here we go. So what you've got is a couple of kidneys, sort of fist-sized kidneys, and think about those water filters at home or at purification plants. Our kidneys are the ultimate filtration units in our body. Just awesome water filters. So blood comes through there, and what they're doing is they're keeping all the stuff your body needs, proteins, vitamins, getting rid of all the toxins it doesn't need. Those go down through these little tubes called ureters into your bladder. And once you have enough pee in your bladder, you feel that feeling, and there you go.
And away we go.
So what if you never peed? I mean, the toxins would just kind of sit there then, wouldn't they?
Well, if you never peed, so one of two things would happen. Either you're not peeing because it can't leave this last tube called your urethra, and then what happens is your bladder grows, and you're in a lot of pain, and you end up coming to the ER, and you know that's uncomfortable. Or you're not peeing because your kidneys have shut down, in which case you need dialysis. So that's a real problem.
That's an extreme case. Let's talk about how much we pee. I'm only asking this question because my producers asked me to ask this question. I would never ask this question normally. How much do we pee? You want to do a demonstration to tell us how much we pee, right?
So here's what I want to do. I want you guys to tell me, by pouring in the glasses, how much pee you think we make a day.
Okay, so I want to do. I have to do it by sound. But you have to be quiet. You have to be quiet. You have to be quiet because I need to do it by sound. So I pee this much. Hang on.
Oh, that's nice. There we go.
So I think I might go a little bit more than that. I'm not sure. Here we go. You're talking a day, right? We're not talking each time.
Full day, full 24 hours.
I'm gonna probably say, come on, there'd be at least 3, at least.
That's been if I've been drinking. I'm gonna say 3.
Yeah.
That sounds right, because I think that sounded like a first one, that sounded like a second one during the day, and that sounds like the third one during the night. How we do? How did I do? How did we do?
What do you do?
I kind of think about 3, maybe 3 and a bit.
Audience?
3?
Are they right?
More. How much?
Usually they're right. Usually they're right. But actually, this time you guys are wrong.
Okay.
You're right. Yeah.
Are we right?
I'm sorry.
So how much do we pee? We pee 3 glasses a day?
3 glasses a day.
3 glasses a day.
Yeah, which if you look at it, I mean, altogether, that's a lot. I mean, some of these are a little bit chintzy on how
right. Okay.
But 3 full glasses a day.
Let's go over here because this is much more serious over here. We're going to talk about what the color of our pee says about our health. Okay. This is what we're doing, right?
Yeah. So there's a lot of things that we can learn. I mean, we do this all the time. We pee a lot, and usually when we're peeing, we're thinking of something else. Our blackberries are. But you can learn a lot about your body from the color of your pee.
And we really should look at the color. This is, but seriously, right? Yeah, we should. Okay, so what is the first one saying about us?
So, first of all, none of this is really, truly pee, so don't have to worry about it. So this one here is sort of that nice, light, straw-colored urine. It's clear, it's not too dark, not too rich. That's normal pee. That's what it should look like.
This is a good pee.
This is a good pee, yeah.
Okay.
And you can see here, it's got the nice straw sort of color to it. Normal, good pee.
All right, I want everybody to run to the washroom and make sure that we're this color. So now it's getting a little bit darker here. What is this one saying about us? Let's move down the table. Let's all come down together. Here we go. So now we're here. This is a shade darker.
Shade darker. All this really is saying you're dehydrated.
Okay.
Dehydrated.
Yeah.
Now why is that saying that?
Because what's happening is your body is trying to, remember that filtration unit? It's saying, we don't have enough water, we got to pull more water in from the kidneys, we're not going to pee as much. So because you're not peeing as much, or there's not so much fluid in the pee, the chemicals that are there are richer, and they just make the pee look sort of darker.
Okay, so sometimes, I've heard, if you drink a lot, sometimes, your pee is darker. Is it because it's trying to filter out the toxins?
Really, if you drink more, or alcohol. Really, your pee should be lighter.
Okay, really? The more alcohol you drink, sorry, the more water that you drink, the lighter it should be, because it's flushing all the toxins out.
Yeah, and it's getting more. Well, two things. One is it's the flushing of the toxins. Secondly, you're getting rid of the extra water. You don't need so much water, right?
Okay, so now let's. Okay, you know what we should talk about as well. You know, some people odor can be an issue sometimes. You know, you can tell. I hear that you can tell something. Actually, my producers told me to ask that question as well. So I wouldn't have asked that question either. Let's talk about odor and pee.
Tell me about your odor in your pee.
I'm not telling you nothing about my odor and my pee. But you know what I do notice? If you eat asparagus or something like that, that the odor does change.
Absolutely,
but that's obviously caused by food.
Yep.
Can different odors, tell you that your health is off or health is good?
Yep. So most times odor is food related. Asparagus is the leading cause. It's the amino acids, when you break it down, have a sulfur type odor to it. But if you smell something sweet, a sweet smell to your pee, and I'm not advocating to go and smell your pee,
right?
But if you've got a sweet smell, that could be diabetes.
I see.
Because what's happening is there's extra sugar in the pee, and that sugar is giving that odor, and that could actually be a clue to diabetic problems.
Okay. Wow. Okay, so what about this guy here?
So this is like lime neon yellow, right? And looks radioactive. There's got to be something wrong with that pee.
Yeah, that's starting to get scary, right? Because we're going to move that over here. That one, just like that right there alone.
It's got to be, right?
How is this? What is this saying about us?
The reality is this is actually good pee, probably.
Oh, is it really?
Yeah, and the reason is when you have extra multivitamins like vitamin B or even just multivitamins in general, your body will say, we've got enough. We've got all we need, and anything else gets excreted. Those vitamins give us this kind of look and appearance.
Okay, and so this is okay. We shouldn't be alarmed, but just, even like maybe stop taking some vitamins for a while and just see if it comes back to this part, yes?
I wouldn't even do that. You know what? Because your body will take what it needs, and anything extra, it'll pee out.
Okay, everybody, we have to take a quick break, but when we come back, Dr. Sharma is going to show us which one of these could take you to the emergency room.
Sharma, and we're talking about pee, and we're talking about what it says about your health. So we've gone down some of the colors of your pee. Those ones over there, we're okay. This is good. Now we're getting into a fluorescent green pee here, and to me, that feels a little crazy. I'd be nervous, right? Should we be nervous with this color?
Well, blue-green pee actually can be benign, or it can be quite serious. So the most benign cause is asparagus. Extra asparagus will cause that sort of color to it.
Okay. How much would you have to eat to have blue-green? I mean, you'd have to eat bushels.
It's not bushels. Actually, no. It's a dinner serving amount, probably a couple days in a row, and that's enough, right?
Okay.
But now the concerning thing here is high calcium in your body will also cause this. And so oftentimes what we'll see is little babies in their diaper will have sort of a blue-green tinge. It's called blue diaper syndrome. And parents will think, oh, it's probably the diaper, it's nothing to worry about. What it is that they're peeing this type of pee, and it's the calcium in their body that's too high, which can signal metabolic endocrine problem.
So you should keep an eye out for that. Now let's moving down to this color here.
This is like is orange.
It is what You're looking through your nose to see what color that is. This one here is that's pretty orange to me.
That's orange pop. Yeah. What does this say?
So what's actually happening here is too much pigment, too much carotene. Now in this case, this actually isn't as bad as the other ones if it's the food. So carrots, squash, all that carotene stuff we talked about with the eyes, not a problem. It's good. But certain medications like pyridium, if you're taking that, will cause this. Rifampin, which is a medication for TB, will cause this. So if you're peeing orange and you're not eating a lot of carrots, you better, you need to go to a doctor and say, okay, I'm not eating anything that's in my diet causing this. Is it a medication I'm on?
Oh, so check that out before you just start panicking and running into.
This one to me, obviously, this is going into the red tinge, and I'm thinking blood when I see this. Am I right about that? Is that what you're seeing?
Yeah. So what we've got here is blood or pink tinge urine. This can be, so people always think, cancer. Tumors, right? The key there is if you're having painless blood when you pee, you should be worried about cancer or tumor. You should be getting that checked out. It could be a simple bladder infection. Burns, it hurts when I pee. STDs can cause urine like that, and people don't always recognize that. And on the other end of the spectrum, toxins.
Just toxins.
Oh, really?
Toxins, yeah.
So from drinking, smoking, poor eating habits.
Well, so the neat thing here is toxin from lead, like lead poisoning.
I see. Something more serious.
Yeah.
Okay.
I see.
This is the big guy. Like talk to that color.
So this is the color that we've sort of thought through in our own minds in the medical field. But what would you say that color is? Like,
it's I don't know.
Tea color. I think it's going to be tea.
Iced tea.
Iced tea.
That's exactly it. That's exactly it. So if you have it up a medical textbook and it say tea-colored urine, think liver disease.
This right away.
Wow, really?
And now, so if you're just seeing this once, and it comes to, is it possible to have, like, if you had a, say you went out, it's a wedding, and you went there and you had a great time, you had way too many drinks, and the next day it's a little bit cloudy, and then the next day it's clear again. Can that happen? Can you see this color for a temporary period of time?
Yeah, and what you're probably seeing is something kind of like this, or something like
and
this.
you're thinking it's this, so don't panic and don't freak out.
Don't freak out.
So you need to see this over a longer period of time?
I mean, if you're not partying, you're drinking well, you're not having a lot of alcohol, and you keep seeing that color.
Right.
Yeah, you want to see your doctor. And you know, I'll see patients that come and say, hey doc, I'm peeing blood. Because they think it's this, right?
Right.
And the reality is once you get a sample, it's tea colored.
Right,
and then you do some liver function and all the smokes, all of a sudden.
And you know there's something serious.
And is it almost cloudier? Like this has a cloudiness to it?
It can, yeah. It absolutely can, yeah. So I guess the key is your urine, which we never look at, right? We're just peeing, can give you hints about what's happening inside your body.
That's right. See?
Now, we all thought about it. It's kind of funny at the beginning, but it really isn't it? You want to be over here, and you really don't want to be over here. Thank you so much, Dr. Sharma. This is great information.
We all should know about it. Fantastic.
All right, everybody, Mo Kelson's coming up next, and she's going to show us how to get that celebrity look. Claudia Schiffer is one of them. You don't want to miss it.